Hey everyone. So we might get started as the last people trickle in, but thank you all for joining and welcome to our next kind of interactive hour and a half. So today is going to be structured a little bit differently and I'll take you through what that will look like. And you're currently sitting in the Global Mental Health Advocacy for National Impact. So a really important topic for those of us who are working in the global space, for those who are working in the international, national space, or even at the community level, because global advocacy impacts everything that we do on all levels. And I'm really excited for this panel that we've got ready for you. So the objectives of today's session are for national partners to have a clear understanding of how global advocacy impacts their work nationally, to exchange knowledge, best practices and resources on successful models of global advocacy in mental health, to acknowledge and leverage the growing role of youth advocates in global advocacy, and to exchange best practices on holding national governments accountable to commitments made at a global level. Also for national partners to learn how they can get involved in global mental health advocacy, learnings from examples of national partners, and identifying a global advocacy roadmap and participants committing to getting involved. So what I might do firstly is I'll ask everybody who works at a community level to raise your hand. Couple, yeah. Those who work at a national level, raise your hand. And everyone have a look, know who the players are in the room, and then everyone who works at an international level to raise your hand. That's okay. For some of us, we might work across multiple. That's okay too. But it's good to know who we've got in the room, and I think we've got a pretty even mix, which is lovely to see. So for myself, I also work across the national and the international level. My name is Maddie, and I'm the co-founder of the Origin Global Youth Advocacy Fellowship alongside Natea, and I'll be chairing today's session for you all. Today will work where we're going to have a 45-minute discussion with our panel, and we've got some pre-prepared questions, but also the way we're going to do this is that if you have a burning question or something that you would like to contribute to the question, raise your hand. Natea is going to run a mic for us, so we've got that there. But if you've got a question that can wait towards the end, then we'll have some time for that at the end of the session. So burning hot thoughts that you want to share, raise your hand, mid-question, we'll come to you, but if it can wait, we'll make some time at the end of the panel. Then we have a national partner presentation that will come after that, and then we're going to have an interactive 15 minutes to discuss kind of what's upcoming in the space and how we can all be involved within our organisations and individually. So now I'm going to introduce our wonderful panel. So first up, we've got Shekhar Saxena. He's a professor of the practice of global mental health at the Department of Global Health and Population at Harvard GMHAN School of Public Health. A psychiatrist by training, he served in the World Health Organization from 1998 to 2018, being the director of the Department of Mental Health and Substance Abuse from 2010 to 2018. In 2017, he received the prestigious Leon Eisenberg Award from Harvard Medical School. He's an author of more than 350 academic papers. He functioned as an editor of the Lancet series on global mental health and the Lancet Commission. His expertise includes providing advice and technical assistance to policymakers on prevention and management of mental development, neurological and substance abuse disorders, and suicide prevention. So welcome. Next we have Dr. Mark van Ommeren. We saw him earlier today. He's the head of mental health unit within the World Health Organization Department of Mental Health and Substance Abuse. Much of Mark's work has been interagency and focused on initiating and developing humanitarian policy and humanitarian tools, evidence-based guidelines, scalable psychological interventions, essential medicine list update, supporting countries to build back better mental health systems after emergencies. To improve the intersectoral collaboration, he introduced the now popular term mental health and psychological support into the interagency humanitarian policy. And more recently, he coordinated the writing of WHO's World Mental Health Report, Transforming Mental Health for All. Next up, we have Omitoyin, who's joining us online. We may have some technical issues with Olu joining us. I've got him? Okay, Excellent. So he is a public and mental health advocate. His prevention-first approach to mental health and physical health has driven him to contribute immensely to various health outreaches in his local community in Nigeria. He helped to start a social enterprise which young people are regularly being reached out to. He was recognised on Forbes in 2019 as a Gratitude Network Fellow in recognition of his contributions to child education. He firmly believes in ensuring the younger generation is equipped with enough knowledge to to have a positive approach as regards to mental health. Olu joined IYMH in order to help ensure that youth mental health is well protected and promoted. So welcome, Olu, and we can see you there now. Next up, we have Wendy Orchard. She's the Executive Director at the IASP, the International Suicide Prevention. She's worked in the field of suicide prevention for over 8 years, coordinating the global network of suicidologists within the IASP. Established in the 1960s, IASP is the largest international association dedicated to suicide prevention and the alleviation of the effects of suicide. It collaborates closely with relevant international organisations. And finally, we have James Sale, the Director of Policy, Advocacy and Financing at United for Global Mental Health, and he is the co-chair of the Finance Working Group for GMHAN. He's a health, mental health and governance advocate, having previously worked with the World Health Organization, Transparency International and Save the Children. So I think we can welcome the panel, and we can all agree we've got a pretty impressive panel here with us today. So now I will come sit here, much more comfortable, being up there and join my fellow panel members. So our first question is, how is global advocacy relevant for national work and national advocacy? And I'm going to start with you, James, down the end.
Thanks very much. First, I'd just like to say about how exciting the global mental health space is at the moment and what's going on. There's a huge amount of things going on, and all of us in the room can get involved. So I'm sure people are following, but on Monday afternoon in New York, we had the adoption of the first ever UN General Assembly resolution on mental health and psychosocial support. What a huge achievement for the sector to have that milestone. The text isn't perfect, of course, because that's how these things work, but it's those types of opportunities that are hugely exciting. And later this year at the UN General Assembly high-level week, we have 3 health high-level meetings on TB, on tuberculosis, universal health coverage, and on pandemic preparedness and response. And all of these are opportunities for mental health to be promoting itself, not just within itself, but also within other areas of the health sector. And that's going really well, and you can follow all of those discussions and the developments that are happening. So there's lots of exciting things happening. That's just in one particular space at the global level. But I think when we think about global advocacy work, particularly in the health sector, I think there's a sort of very credible and fair opinion that this is things that happened in Geneva and these are things that happened in New York. And what is said in Geneva and what's happened in New York doesn't translate to what's happening in New Delhi or in Abuja or here in South Africa. Like, these things just don't come back with the heads of state. And I think that's much of that is fair. So how do we work with that? How do we work within that system? Well, there's 2 things I think we can do. One is that we can create opportunities at the global level for national advocacy objectives to be advanced. An example I'd like to give is that, I don't know if Taha is here from Taskeen in Pakistan. He's around a conference, and you should ask him about this if you get a chance. But you'll have heard today that we mentioned that suicide was decriminalized in Pakistan at the end of last year. What a huge achievement in what was a difficult political environment. Now, 99% of the advocacy work was done by Taskeen and other national partners to make that happen. But there was a role for global advocacy, and what happened there was that we were informed, and others at the global level were informed by Taskeen, that the government would listen to international voices, particularly if there was any criticism in, say, global media outlets, and also if we could get champions from Pakistan and particularly from the legislature at a global level. So what we did is we spoke to journalists at global media outlets, and there were articles written about the state of criminalizing suicide and suicidal behavior in Pakistan. And then we were able to make sure that those articles that are written. One was in The Guardian, which is a very good one to go and read, made it across the desk of the health minister. And then we put on events at the global level for supportive senators from Pakistan to come and speak about why they should be decriminalizing suicide. So I think that when we think about global level advocacy, sometimes we think about it within itself, like it's for itself, like for these resolutions, for these things that happen in Geneva, for these things that happen in New York. But what we can do is create platforms to advance national advocacy and work to support national advocacy strategies. So it's not just at the global level. And just one other thing to mention is that when we're dealing with governments, particularly at those sort of UN processes, those are different parts of national governments that are being represented there. Often it's part of their sort of state departments or foreign departments, those types of elements of governments that are staffing their missions in Geneva and in New York. And there's an opportunity to speak to those parts of government, whereas quite often at a national level we're speaking to health ministries. There's an opportunity to get outside of that. And I think the theme that's developing throughout today, certainly, and I think it will continue tomorrow, is that mental health is not just the sole responsibility of health ministries, that it's a cross-societal and therefore cross-governmental issue, and it requires that cross-governmental response. So acting at the that global advocacy gives us an opportunity to speak to different parts of the government. And so I think there's how those two things relate to each other.
Yeah, great. Thank you so much, James. And I'll pass over to you, Wendy, to answer that one now.
Absolutely. Well, it is exciting what's going on in the global advocacy field at the moment, and as James says, in New York, in Geneva, and places. But I think it also is really important in terms of the community back on a national level. There, particularly, for instance, in my field in suicide prevention, there are many, many countries where people feel that they are working, or the only person involved in suicide prevention, or the only one concerned. There's nothing going on. So what it does is actually bring you a community, an international community that can help support your voice and help link you with others, whether it's regionally or sometimes also nationally. You might find that you meet someone who is also working in a country that you just haven't come across. So I think it's really important in terms of building that support and building that voice. And it's also an important opportunity because these commitments made at global level are important to be reminded at national level. They are for national level. If your government has agreed and signed up to, for instance, the SDGs, those are commitments that they've already agreed to, so it's reminding them and putting pressure on them. But they're global commitments that you can bring back to a national level. So it's exciting.
Yeah, great. Thank you so much. And what I love from both of your answers there is really that importance of community that comes when global advocacy is really relevant for the national advocacy that we're doing, whether it's giving support and leveraging, by showing what's happening in the global space, or the inverse and showing what's happening in the national space, but also allowing people to feel like they have a sense of community in the work that they're doing, that they're not alone in that. So thank you both. So our next question is, what are the best ways to conduct global advocacy to secure meaningful commitments on mental health? And I might go to you, Shekhar, for that one.
Thank you. Delighted to be here. I have been a global advocate for a very long time, but I'll be perhaps the first one to admit that global advocacy has absolutely no meaning unless it really translates into national efforts and actually helps people. Otherwise, it is completely useless because global advocacy, if it doesn't help people, it has no meaning at all. But yes, the interaction is bidirectional. So global advocacy leading to global commitments actually helps national advocacy and vice versa. If there was no national advocacy, then it will be very difficult to achieve global consensus and both help each other. I would also like to add 2 points. One is that advocacy at global level or at national level or even at local level needs to be information-based and quoting true facts. It may not be the whole truth, but it has to be truth. You can be selective about truth, but you cannot be untrue. And that's really very important because at a global level, it's an aggregate truth, but at a national level, it's much more specific and relevant to that country. So it is possible to be selective, but it has to be factual. I think we need to move from flag waving to data waving. And in one of the morning sessions, we actually discussed that over 90 minutes to say how can data help in advocacy, both at a global level, but also at a national level. And the data sources vary. The global data sets, including the indicators for the mental health action plan, are at a very high level. Nationally, they have to be much more specific and much more relevant. But there is a correspondence between the two. So unless there are global indicators leading on to global advocacy, national advocacy and data will suffer, and vice versa. So it is very much interactional. And if one did not exist, the other will also not be very helpful. I'd like to add one more point, which is important both for global advocacy and national advocacy. The advocacy, to my mind, is an art and a science. Some people are born advocates. They do it anyway, and they do it effectively. But a lot of us can learn from the science, from the experience of others. There's a lot of literature in social sciences, political sciences, also in management science, on the process of change and how one can stimulate, catalyze, in the words of somebody who spoke in the morning, to push change. And there is a science behind that. So advocacy is not doing anything. Advocacy should have clear targets, clear objectives, and a clear process that leads to change. And I think we can all learn from that process. Some of us are smarter than others, but all of us can become smarter by heeding that kind of advice and experience of others. And again, connecting back, national advocacy efforts can learn from global advocacy efforts and vice versa. Thank you.
Great. Thank you so much, Shekhar. What about for you, Wendy? What are your thoughts on this question?
In terms of the best way, I always believe 100% in collaboration at all levels. So for global advocacy, it's really important to collaborate amongst yourselves, amongst your peers, not just focus on your own specific cause. For instance, with us, we have our World Suicide Prevention Day. That leads into World Mental Health Day. We highlight decriminalization on Human Rights Days. So it's really important to strengthen that collaboration because together it actually is a little bit more powerful. And I would also then translate that back into national advocacy, is bring your collaboration together, bring all your different stakeholders because they might have channels that you don't have and use your whole, as a collaboration, all the tools that you bring to that advocacy. So I would say on all levels, collaborate.
Yeah, thank you. And a beautiful point to end on that. Importance of collaboration that we're hearing through this panel, but also through every panel and workshop that we've had so far today. And I think I sat in the data workshop as a researcher. I am pretty biased. I do love some good data. It's pretty important. But I think that point of using global advocacy data as a way to secure those commitments for mental health is really important, particularly when we look at a lot of countries or even communities where we don't have the research that we need. But like you were saying, Shekhar, is that we can take from the global space. We can take what is useful, not fabricate the data, but take what is going to help us to build our argument to show the importance to then continue to do this national advocacy and do that cross-collaboration, as you were saying, Wendy. So thank you. And so now I'm going to go to Olu on the screen. And this is about how are youth advocates conducting global mental health advocacy and why are they so important? Can you hear us okay?
Okay, yes, I can. Yes, so I believe you can all hear me. Because of my background, starting local to global, I always have a tinge of beginning from the roots because I believe it's very important in global advocacy. But for youth in global mental health advocacy, they can engage in various ways such as education, utilizing social media, educating the public, and writing articles and conducting outreaches to help propagate the in quote good news of positive mental health behaviors and attitudes. For example, in Africa, when you're talking about global mental health, when it comes to the sphere of Africa, you're going to be talking about dealing with things like stigma. But you know, it varies from region to region because different people are battling different things or are working on different things. But the point still boils down to the fact, as my other panelists have said, you're taking what obtains in the global space and then redefining it or modifying it to the national and local levels for where you come from for a particular level. Okay, so other things that youth can participate in support, for example, peer support. Thank God for the internet age where you can provide support transcontinentally now. Then youth can engage in research when we have places where there's paucity of data. We just spoke about having a lot of data. Where there are places that are paucity of data, you know, youth can engage in research in order to boost data. And when you have data, you're able to have proper advocacy plans. You have facts and figures to be able to back up what you're saying. You're not just going out there without facts and figures. So that's another opportunity that youth can partake in. Then youth can also partake in global collaboration. And this is why I mentioned starting local. For example, I'm in Nigeria, I'm doing something local. I have friends in the UK, I have friends in the US. Then we together, we say, okay, let's see what can we do collaborating with each other. And that's why I'm having amazing meetings like this. You meet people, you network with people, you get their contacts. We are in the same, we are doing the same things or similar things. We talk about things, we brainstorm, we get innovative ideas, and we execute across board. Locally, we execute it, but it's still having global impact because when you have someone from Nigeria, you have someone from South Africa, you have someone from India, all executing similar plans but to suit their locality, then you begin to see that everybody is beginning to have positive changes. Then I would also say that young people should not shy away from going for opportunities that afford them the ability to meet with policy makers. For example, this meeting, you meet people from WHO, you meet people from USAID, you meet people from all walks of life. You are able to pitch your ideas, you're able to pitch even places where you can't reach. These people, these professionals that have gone ahead of young people, they can reach there. A 5-minute conversation can spark a whole lot of change. Just walking up to a person and just telling them what you feel about a particular issue that can be dealt with, even if you can't reach there, that particular person can pitch that idea in places where you cannot reach. Then also, I think young people becoming mental health professionals, social workers, medical doctors, psychotherapists, therapists, just getting involved in this field professionally can also be a way where young people can actually advocate for mental.
Just wait 1 second. Hopefully Olu might come back.
Health global. Abilities are endless, but it just has to be. And I'm so excited because who have done amazing things when it comes to youth advocacy. And to buttress the importance of young people being involved in global advocacy, I say for sustainability, because the young people are the future. So when you get young people engaged at such a time, when they start from a young age, imagine myself from Nigeria, then we have people from Denmark, from Norway. We are all building something. Eventually, when we get into our 30s, 40s, 50s, 60s, and we are the ones in charge, we've already built a legacy of positive impact when it comes to mental health, because we are not starting at the very late stage. We're involved from a very young stage, and then we've created a culture already, a culture which we are passing down even to the generation behind us, and then it just builds a cascade of positive development. And then we see within the next 10, 20, 30 years, we see that mental health has gotten to a stage where it is inclusive of almost everyone globally. Then young people are able to identify health behaviors, formulate and implement action strategies, and generate substantial positive impact for themselves and their communities. The ability of young people cannot be overemphasized. We have young people who are influential in their community, in their families, and truth be told, we are talking about global mental health advocacy, but something that starts local can go global. And that's why I always emphasize the importance of local advocacy also. I'll just run through the other things I have with me. Young people can be very instrumental in leading the initiative. You know, when you have a young person's perspective, it's good to have when you're dealing with a global issue, it's good to have the perspective of the young people, it's good to have the perspective of the professionals, it's good to have a lot of perspectives. So having perspectives from these young people can also put the team to a different flavor that was not thought about without their input. Then young people have seen this a lot. Young people can initiate a lot of change, a lot of initiatives on the local.
What I loved the most there is that even though we did lose you for a brief second, the passion came through, and I think we could kind of fill in those moments, which I think speaks to the power of youth advocates. We could feel, we could hear that passion coming from what Olu was saying, and I think really that is the power we need to harness. And Olu did a great job of listing all the different ways that young people and young advocates are advocating for mental health, whether it be supporting other advocates in research, in advocacy elements on policy, in service provision, but also collaborating with one another and providing that youth and lived experience perspective, which we know is so crucial within this work. So thank you, Olu. So for this question, I'll go to you again, Shekhar, and it's how can global advocacy messages be suitably adapted for national priorities?
Me?
Yes.
Well, as we were discussing earlier, the two are interdependent. So global advocacy does lead to facilitation of the national advocacy and vice versa. But there are differences, and one of the differences is on the kind of goals and objectives and indicators that you keep. The global indicators are very much aggregate, and the national indicators can be much more specific. Giving an example, can you still hear me? Giving an example, global target for advocacy is, for example, decreasing the suicide rate for the entire population, for the entire world. But the national target could actually be, the national target could be much more specific. Decreasing suicide rate amongst young people, decreasing suicidal attempts actually in young people, and so on. So those kind of modifications have to be made in the indicators and the targets which are there for the national advocacy versus the global advocacy. But there is also another difference, and that is the entry points and opportunities. Global opportunities appear from time to time, and one has to take advantage of that. National opportunities occur maybe at different times, and one can be ready for that, or one may not be ready for that, but one has to look for the opportune movements where one can make that impact. It can be very wasteful, both sides on global as well as national efforts, to be trying for everything. Because you can realize very soon that you're not going to succeed. And then it is perhaps better to change the focus. I'll give you an example from the global advocacy field. When in 2015, mental health was included in the SDGs for the first time, and the Mental Health Action Plan of WHO 2013 was passed, there was a very serious thinking around trying at a global level to establish a fund for mental health on the pattern of global fund for TB, malaria, and HIV. Very soon we realized that there is no appetite for that. So if one had tried, one could have succeeded, but in my opinion, one would not have succeeded, and one would have lost a lot of momentum, one would have lost a lot of opportunities. But at a national level, to try to increase the budgets out of the health budget for mental health did succeed a lot, actually. And WHO's Atlas has very clearly demonstrated that there is, not in all countries, but in many countries, a substantial increase in the budget because of the two things, SDGs and the Mental Health Action Plan. So what did not succeed at a global level did succeed in many countries. So there is a difference about those opportunities that might come up. And obviously it depends on your evaluation of what is a good time to try what. And that is something that we all need to think very seriously about. Advocacy efforts cannot be unlimited. There is a limited amount of manpower and time and money that is available for it. And I think the critical task is to use it very efficiently so that one can get maximum gain. And the parameters for doing that are different from global versus national, and actually for local advocacy, which is also very important. So those are some of the differences that I can think of.
Yeah, excellent. Thank you so much, Shekhar. And I think that ties in really nicely to the next question, which is, how can national governments be held accountable for the commitments they make at an international and a national level? So I think a little bit of an adjunct to what you were saying, and I might get Wendy to answer that one. We'll see if your mic works, otherwise we've got the roving ready.
Can you hear me? Yes.
There we go.
Okay. It's really, as was said this morning, push your national government. They have signed up to these commitments. Be loud about it. Don't be afraid to say the government is committed, the government has promised to do this. Be loud about it, but also offer to help them. How can we help you do this? It's really important because it gets the message out that you're all part of it, you all want to be part of it, you all want to help get to that goal, but it's also not just necessarily pointing fingers and saying, what are you going to do about it? So that would be my first key thing, is to push them, but offer to help them, and remind them also that time is ticking.
Yeah, excellent, thank you. And what about for you, Mark?
Well, first of all, I'm sitting here and listening very carefully. I mean, advocacy is not something that comes naturally to me. It's something that if there's some people are, I think Shekhar said in some way, some people do it naturally all the time, and you wake them up in the middle of the night and they will say, we need a bigger budget for mental health, and the numbers are so high, it's a treatment gap, whatever. And other people need to, they need to be prompted, right? And I'm probably on the side where I need some preparation to say the right thing at the right time. Now, I think on this specific topic, so I'm listening here a lot, learning. One of the things I think on the question is, well, governments make commitments. What can you do with it? Well, I think that's of course opportunity, right? Because any government wants to be seen to keep commitments. So that is, if one talks about fact-based advocacy, there's your fact. You have committed. It's one of your arguments. But of course, if nobody knows that the commitment was made, then let's say you're an advocate, you know that this commitment is made, and 10 other people in the country, and you go to the government and say you made a commitment. Why would the government really care from a political perspective? At least because the public doesn't know. So I think it's more than just going and saying you promised. I think all the usual strategies of advocacy need to be applied to use this fact. And from my experience, my own experience of advocacy is probably mostly with a few years ago with having the Netherlands Ministry of Foreign Affairs take on mental health as a serious topic in its foreign policy. And if I think of how that was achieved, it was very much thinking about who to talk to. So this is analytic with who are the people that are most likely to have an influence on decision makers, and eventually are the parliamentarians who are parliamentarians are very, very important in most democracies. Who are the parliamentarians that can be reached? Who are the parliamentarians on which committees do they sit? Because the committees within Parliament often have a lot of decision power. So it is this kind of strategic analysis, and then bringing together groups of people that, like the WHO, I cannot advocate against for governments individually. It's not the job, certainly not my own one. So, but we could convene actors in the country, as anybody can convene, and then different actors have different roles to play to push the story, and to advocate with the people who have an influence. So I think I think advocacy in the long run it's best. Just like we talk about things being sustainable, whether it's a program or a project. Same thing for advocacy. Advocacy is most sustainable if the advocate gets credibility, and if the advocate is known for hyperbole and for exaggeration and over advocacy, is not taken serious. But if the advocate knows her or his or their stuff, and if the advocate is held credible, it will go a long way.
Great.
Can I add something?
Yeah, of course.
I think just picking up from what Mark said, I think credibility is important, and I want to touch upon the credibility of people with lived experience, which is perhaps one of the most credible voices that we can have in the field. I'm a professional mental health person. If I did not talk about mental health, what would I do? But it's very important for people with lived experience to actually do that. They might be engineers, they might be doing something else, but they're talking about mental health because it concerns them. They did not have to, but they're doing so, and that is really the most credible aspect of that voice. And I think there is a lot of movement now. In the last 10 years, we are hearing many more voices of people with lived experience, especially more so of young people. And I think that, to my mind, is the best forces for advocacy in the current times.
Yeah, what a lovely note to end that question on. I think the voices of lived experience, particularly young people with lived experience, are really powerful, and we've seen that showcased here today, and I'm sure you've all seen that in your work within your respective organisations. But what I love about that question is, like, how do we use this commitment as a piece of data in our advocacy to show governments that this is what you've committed to, and then using the usual stages of advocacy to then kind of communicate that to your government, but also lending out your own expertise, your own support and help is really crucial. And I love that point that you added, Wendy, is like not only, saying to your government, you've made this commitment, but you've made this, and here's our expertise, and here is how we want to help. So I think that is a really crucial part in using, as you said, Mark, all of those stages of advocacy that we all know really well, whether you're a natural born advocate or someone who finds it a bit difficult, but you still do it because we care about this work. We want to see change happen, and that's what matters really the most. So we've got one final question, and then we're going to throw to the floor. So have a think of some questions that you would love to ask this incredible panel. And this one is, what platforms are the best for national civil society to join to contribute to global mental health advocacy? And I'll start with you, James.
Well, obviously the Global Mental Health Action Network.
It's not a paid ad, I swear.
Yeah. I think you might all be converts already. But there's lots of official processes for civil society to engage or official platforms, in these types of processes. So take the G20 process, there's the C20, and there's a similar through the G7 and the C7. And actually, my experience of those types of platforms is that they aren't just limited to advocates from those 20 or 7 countries, that you get organizations and advocates from all over, really, trying to influence those countries for a number of reasons. And then similarly through UN processes, there's similar types of engagement mechanisms. And you'll often also find that you'll get sort of maybe lead or champion civil society organizations that take it upon themselves to try and organize and coordinate the rest. So, I mentioned that there's a high-level meeting on TB in September in New York, where the Stop TB coalition is doing a huge amount of work to try and bring civil society together and sort of formed, in a way, an unofficial platform. So there's often like lead civil society organizations to work with and to get behind. But I just echoing the point about young people. There's a huge amount of sort of non-traditional ways that advocates, particularly young people, are starting to engage in those official processes, and they're having huge amounts of impact. And it's a really effective way. And the session in this room before the break was on youth mental health, and I think we're all agreed how important that is. But also, youth mental health is a great pathway to talk about general mental health in those types of processes. This might sound a bit cynical, but if there's an official process or an event happening, a high-level event, it's very rare that the organisers of that event will say, no, I don't think we should have a youth health advocate involved. Mm-hmm. And if youth health advocates are speaking, there's a good chance that young people will talk about mental health in the same breath as physical health. Quite effortlessly, actually, in a way that is so refreshing to hear. So I think there's official traditional channels and structures that are set up. There's some lead organizations that are taking that upon themselves. And then there's actually this wave of sort of new alternative ways of trying to influence those processes, particularly from youth advocates, and they're highly effective.
Excellent. Thanks so much. And Shekhar, do you have any final thoughts on that question?
No. Global Mental Health Network. That is the point. But informally, I would like to say, really, there are some formal platforms, more formal organizations, federations that you must look out for, and they may not be in the area of mental health. They can be in the area of gender equality. They could be on violence prevention, and so on. So one has to look for that opportunity. But also there is a more informal process, and at least for the time that I was working for WHO, if I went to a country and had a meeting with the policymakers, I'll make it a point to invite the civil society to join that, which may sometimes be the first time that they were meeting the policymakers. So look for those informal opportunities which can actually equip you better to know the policymakers better, including the parliamentarians, and then continue that collaboration, because many things happen very, very informally. And that is something which we have to really exploit. Sometimes it's the Minister of Health's daughter who had depression, which is actually the best thing that happened for that country. And we it's sad to say that it happens, but it does happen very commonly. And those ministers or those officials are really the true advocates for that. So look out for those opportunities.
Yeah, what I really love from both of you there is that looking for those informal advocacy channels, and also the creative ways of engaging people, particularly young people, even thinking about the intersectionalities when we're getting people to present that we know mental health is going to come up. So even if it's not specifically a mental health conversation, finding the way to bring that in, because as we know, mental health is a very intersectional topic, whether we're talking about gender equality or physical health. So thank you for that. That kind of concludes the formal questions, but now I'm going to pass, we've got a roving mic coming around for some questions from the floor. We've got one here.
Thank you so much for that session. I guess my question is, whenever we are talking about national action, I hear a lot of talks about the government working with the public sector, but somehow the private sector is missed. We don't have enough conversations about how to engage at the country level the private sector, and also understanding that when we say private sector, we don't mean the pharma, or we have private community outlets, whether it is pharmacies or drug shops, or we have private health facilities that have the ability to start mental health units without really relying on the government and its resources. So just a few thoughts about that, like how do we engage the private sector when it comes to national action?
Who would like to take that?
I can take it on.
Great, thanks, Shekhar.
I think it's very important, and of course there was no question asked, so no answers made. But increasingly, corporate sector, including public and private corporate sectors, are key stakeholders in those attempts in a variety of ways. The first way is that they have a large number of employees, and at least they can do something for their employees. In fact, there is a lot of movement now on mental health at the workplace, and that is really quite important to do. The second is that can they do something for the community? And many private sector, I'm excluding pharma for that because there is a lot of conflict of interest there, but private sector is much larger than the pharma sector. So many of those people, including their foundations or CSRs, can actually do a lot for the community, whether it's in schools or in general community, or dissemination of information, including providing IT support, media support, and so on. So that can be another channel where they could be active. But there is a third way. Many countries, private sector actually has very close ties with the government. And those could be exploited in a nice way to influence policy. But here one has to be very careful that it is for general good and not for the good of the private sector itself. So there are a variety of ways in which that could be done. Several organizations have their own policies about interaction with private sector, and lunchtime we heard about some of those. Of course, those guidelines and guide rails have to be respected, but increasingly it is quite clear that corporate sector and private sectors have a lot of role in mental health. If we keep saying mental health is everybody's responsibility, we cannot actually exclude the private sector from that.
Great, thank you so much. And do we have any questions online? Yes.
Hi. Yes, there is a question from online from Amina Babirier from Stop AIDS. I recognise the growing movement of decolonising international development and its impact on mental health within academic and clinical contexts. How can we, as global health advocates, actively implement strategies to decolonise mental health and foster culturally sensitive approaches within the international healthcare system?
Great question. Who would like to take that? And Olu as well, if you would like to answer any questions, please just come off mute.
I'm happy to, if you want to. Gosh, great question. I mean, it's good to hear from you. So I think it's going back to that point earlier, which was about creating opportunities at a global level to advance national advocacy objectives, so that we're not, when working in global advocacy, it's not just to change things within that global bubble, but actually it's about integrating that. And it's speaking to national advocates and national champions and saying, you know, when you're developing advocacy strategy, do you think there's a role for the global level within that? And do you think it'd be useful? And if it is useful, then how can people working at global level be helpful and to make it useful for you? I think the idea that things change at a global level and that trickles down to a national level is not really true. And actually, you know, it's about creating this ecosystem where at all levels we've got this discussion about mental health, which is meaningful and that can be lived up to, and then we can hold those in power accountable to. So I think it's really about thinking about the national and subnational advocacy objectives first, and then seeing if there's an opportunity at a global level to help advance those.
I can talk a little to this. So I work within the global space, but I'm also a PhD student, and my work is with Indigenous Australians. And our knowledge of health and mental health comes from a really different perspective when we consider it looking at an Indigenous perspective of social and emotional well-being versus our very Western biomedical model that we use in Australia. And I think this decolonising approach is so great to see, and we're seeing it happen in research, in advocacy, in policies, but I think it's one that we're all still learning and trying to understand, and it's something for me that has been a really steep learning journey of understanding how I can make the two systems that are really polar opposites find the synergies to be able to connect. But also, I think for me it's been having the courage to stand up and say, like, actually, no, this isn't how I'm going to do it. I'm not going to work within this kind of Western biomedical model. I'm actually going to do it this way, even though if it means that it's going to take a bit longer, or it means I'm going to have to fight a bit harder than I traditionally would. And that for me has been a really nice switch to see happening across the board within global spaces, but also back home within Australia. And I think it's a conversation we all need to keep having to understand how can we be more culturally responsive and how can we decolonize these approaches. And I think the most important knowledge comes from people from those communities, from people with lived experience, and talking to them and letting them lead the forefront of this change. And we're going to have an opportunity for a few questions after, or some thoughts. So sorry, I see your hands. We are just going to move to the partner presentations now, but please keep those questions. We're going to have a discussion at the end about where to from this. What can we do moving on? I'm going to go stand back at the lectern now, which seems oddly formal, but also feels like what I'm meant to do. So here we are. So we're going to have two presentations now, and you're going to have a chance for Q&A with those presentations. We've got two speakers. So we've got Aditya, is one of the key staff in the Pusat Rehabilitas Yakkum Foundation, who has more than 6 years' experience in the communication, advocacy, and public campaign in disabilities and social inclusion. In 2022, Aditya also in charge of representing Yakkum in advocating at the G20 policy through Civil 20 Engagement Group to integrate mental health issues within universal health coverage. Together with PR, Yakkum's partner, Aditya also leads the initiative of religious leaders, Declaration for Mental Health Indonesia, which also holds a Guinness World Record. Now Aditya is the head of Holistic Rehabilitation Program, and Yakkum, responsible to manage every program that's run out of Yakkum. And then we also have Priti, the CEO at GMHAN. She focuses on building the grants portfolio, which is primarily community-led, spearheads the advocacy initiatives where she leads the work on suicide prevention, workplace mental health, working with the government and collaborating with funders to invest in mental health. Priti has also been able to conceptualise and implement programs and training to build the mental health ecosystem in India. She has 25 years of work experience and has worked with not-for-profit organisations working on the issues of mental health, child rights and homelessness, as well as for-profit organisations in banking, financial services and ratings. She has extensive knowledge in finance, strategy and HR, and aims to combine these experiences with her interests in rights-based mental health to spotlight and support organisations and leaders providing community-based interventions. Priti also sits on the advisory board for GMHAN. So again, another two incredible speakers who are going to share a little bit about their journey with national and global advocacy impacts.
This is the next, okay. Yeah. Hi everyone, good evening. So lovely to be here to share about our experience in conducting the advocacy on the G20 presidency in last year in Indonesia. Let me introduce myself. My name is Aditya, as said by Wendy a moment ago. And now I would like to share about the global advocacy for national impact. As actually it is C2022, it is led by Indonesian government, as you already know, and it also held in Bali. And last year, Yakkum has included in the vaccine access and global health working group. Actually, in the last year G20 presidency, we are included in the C20. And as we already know that last year, mental health has not become the priorities of the G20 and C20. That's why we are, as the national partner of the United Global Mental Health and the member of the Global Mental Health Action Network, we would like to conduct advocacy in national level through the Civil 20 membership to conduct advocacy on the mental health. So it become the priorities, and it could be stated in the policy of C20 and G20. And beside of that, since we are working on the universal health coverage as well, last year when we are joining, even universal health coverage also not become a priority issue from Civil 20 as well. So it became like a hard things for us, and it becomes new things for us, because last year become our first opportunity and our first chance on doing the global advocacy, because previously we are only doing on the national level advocacy and local level advocacy as well. And in the advocacy efforts, beside of doing the formal meeting, online and offline in the Civil 20, we are also approach and doing the informal meeting, as Professor Shekhar also said that the informal meeting is as important as the formal meeting, because of we could propose and we could share our why mental health is important to be included in the G20 policy as well as in the Civil 20 policy. It is because in the Civil 20 mechanism, the Sherpa and the chair of the working group held the important stakeholders to decide which issue become the priorities issue of the working group and the Civil 20. As well as we are also approach the General Secretary of the Ministry of Health. So hopefully we can propose the mental health to be included in the G20 policy. Besides of that, we are also doing advocacy effort in conducting side event on the C20 meeting. On that time, we are doing the capacity building on the mental health and how it could be integrated in the universal health coverage. Since we are the only organizations in Indonesia who are working on mental health who joining the Civil 20. So we have no allies in Civil 20, because in Civil 20 mechanism, every organization has priorities issue, and we need to fight, or we need to try to integrate on the mental health and how it could be integrated into various issues, because we think that mental health is cross-sectoral issues, and it can be mainstreamed into other issues as well, like TB, HIV, and other issues as well. And besides of that, we are also conducting campaign on the C20 pre-summit, because we would like to showcase and we are doing the evidence-based advocacy that mental health is important. It could be done by the local government and national government, and how the practice of the implementation of mental health in the UHC mechanism. And besides of doing on the C20 advocacy within the formal and informal meeting, together with 5 religious leaders, we use this momentum, we use this G20 momentum to sit together with 5 religious leaders in Indonesia. It comes from Christian, Muslim, Catholic, Hindu, and Buddha religious leaders. We collaborate with our partner from Black Dog Institute to facilitate the development of religious leaders' declaration for mental health. Why we use religious leaders? Because Indonesia population are believe to the religion much more rather than government actually. So we use the religious leaders to provide, to reduce the stigma and to help us to advocate to the government. So we can advocate together, we can get more allies to advocate the mental health issues on the policy. And it is the result. Actually, we are succeed to put mental health on the C20 policy pack. But in the G20 declaration, mental health is not specifically stated as the G20 presidency declaration, but it also included in some other aspect like the elderly, the disabilities, and the climate change as well. And beside of that, we also have declared the religious leaders' statement on mental health, which also break the Guinness World Record as the largest mental health education around the world, which attended by more than 2,000 people, both offline and online. And it is a strong movement and a powerful movement for us, since up to now, the religious leaders are keen to help us and support us in various things. For example, this year, Indonesia developed an omnibus law on health issues. So it contains many things on the health aspects. And because of our activeness in the last year C20, especially when we are always advocating on mental health, the government seen and acknowledge us as an organization who have expertise on the mental health. That's why we also involved by the government to get input on how they could put mental health in the Indonesian national law on health. And besides of that, the religious leaders also supported us by making like a series of discussions to provide support on the national health law as well. For example, like 2 or 3 months ago, the Islamic religious leaders held discussions inviting the ustads or the other Muslim leaders around Indonesia to getting support on how they could prevent suicide in Indonesia. And they are proposed to the Ministry of Health in Indonesia. So in the latest update, the Ministry of Health already put the mental health and suicide prevention paragraph on the draft of Indonesian health law. So it becomes like a big thing for us to conduct the advocacy in the C20 and G20, because it is not only the result, but we also see the momentum, because advocacy, we think and we see advocacy is like the momentum on how we could use the momentum to sound, to speak on what we have done and what we want to the government. And beside of that, through the C20 advocacy last year, we get more alliance to do the research, to do the collaboration on how to doing advocacy, because we are getting known by the other organizations as an organization in Indonesia who are working on mental health. So whenever they would like to do the research on mental health, for example, they will contact us. They will contact Yakkum, because they know that we are doing mental health issue, and we have done much things on mental health issues as well. I think that's all that I can share, and thank you.
Invite you, Priti, to the stage. Well, what we'll do is, after this presentation, we'll move into the interactive component and combine the interactive component and Q&A, just so we can maximize our time with our incredible panel and speakers.
Hi, I'm Priti. So I'll start off by giving about how Mariwala Health Initiative, which I represent, has worked on national advocacy in the past. And I think my presentation is going to be summary of the discussion that happened, because I'm realizing all the points were already covered. So we have worked in the past at a national level, where we work with politicians. We have to include mental health in their political manifesto. So in India, mental health advocacy is happening in the reverse order. So we had the Act in 2017, but there's no implementation because the act happened without political parties asking for it and the public demanding it. So there is no interest in implementation. So our advocacy is more on implementation than the act because the policy or the act is brilliant. So we started off with asking political parties to include mental health in their agenda. We also worked on similar thing for National Suicide Prevention Strategy, where the health department had never acknowledged suicide as a health indicator. It continues to be captured as a crime data, which is a colonial legacy that we have. And only in last year, November 22, we got the health department to release a policy document. Again, there we worked with members of parliament. So we worked with political parties, we worked with members of parliament, and I think in late 2022 is when James had reached out to us and asked us if we would be interested in working on the C20 and G20. And we said, why not? Since we are already working with the political environment for national events, why not look at an international event? And that's how we got involved in it. And which is where my summary of the presentation of the talk happens, is I think it's important for us to understand why are we getting into this space, because working on a global agenda is very different from a national agenda. Because what you may already have at a national level may not be present at a global level, and you need to be able to think about what are you going to talk and how are you going to talk for it to be accepted at a global level. And also, like previous speakers right from session 1 have been saying, advocacy is not an easy journey. It has a very high failure rate or very low success rate, let me put it that way. So you need to be aware of that when you get into it, at least from a headspace perspective. And for MHI, it was important to have that. Do we really want to get into this? Because we have not done it. It may not make a difference to us, because our policy documents are already strong at a national level, but we decided to go for it. I think the next activity required for any kind of advocacy is to have a strategy. Good intent, good effort is not sufficient enough to get results. I think it is important. And as I think Shekhar has been saying, you need to be opportunistic. And for us, when we looked at G20, it was just opportunistic, because we said, India is having it. We already have a great mental health policy. Let's start about talking about it. So in our head, the pitch was going to be, India should take the ownership of being the front runner in mental health. We already have a brilliant policy, and all of that is our talk. So I think it's important to understand the opportunity that arises. It's also important to know whether you will go alone or you will go as multiple people, because in the first 2 advocacy that we did, we actually went out with a core team. So we had a core team that would that would have a consensus, and then we would do the advocacy. Here we decided we already are going to have more people challenging us, so we will do it alone. This is a change from our national level strategy that we have done for our advocacy work. It was also important for us to understand who are the stakeholders. So it is a G20 event. G20 event is very different from how you do advocacy otherwise for mental health, where you do it with the health department. G20 is attended by finance departments. G20 in India was going to be led by the Ministry of Commerce, which is a different ministry. And of course, MHI is a personal philanthropy of Mariwala, who is a business leader. So it made sense for us because we understand that ecosystem also well. It was also important to understand who are the influencers to this conversation. While Civil 20 is the exercise, the decision maker is a G20 event. The decision makers were others outside of it. It was also important for us to understand the context in India, because the Civil 20 was being headed by an organization that was not known in the development sector. It was held by an organization that has never done advocacy work. And many from the civil society were therefore not willing to be part of this process because it didn't align to their values. And as MHI, we felt this is what we have. So let's work with that, and we chose to go ahead with it. There were a lot of deliberations on whether we should be part of this process because of the organization which was holding the entire Civil 20 process. I think as a strategy, it's always important to also be aware what's your minimum ask. You cannot get the world out of one conversation and one opportunity and one event. And a minimum ask is something which we say 2 sentences, simple, everyone can use the same learnings. So for me, in my mind, it was 1 line on mental health and suicide prevention. Just 1 line. Like, that's my minimum ask. But when you have that minimum ask in place, what it does is, I'll shift to the next point, which is bring in collaborators. We could speak to everybody. So we were invited to a panel discussion on women empowerment and education. And we went and spoke about mental health over there. And they agreed because they are seeing the challenges on school-based mental health. We went on, we became part of 2 broad verticals within the Civil 20. One was integrated holistic health, and a new vertical that got started this year in India, which is disability, equity, and justice. Again, we went there, we said mental health is part of disability. And in India, at least, the law has Rights of Persons with Disability Act, has psychosocial disability. We said we are part of you. Let's do a conversation on mental health. So wherever we went, we tried to say, just include mental health in your agenda. There was a conversation on non-communicable diseases, we said, do mental health. There was conversation on traditional medicine, we said yoga, mindfulness, talk about mental health, right? So you had to go to every subcommittee that you could get into and say 1 line on mental health, because that's the ask. And it's easier to convince because when it gets aggregated, everyone is doing 1 line on mental health. We still don't know the results, but hopefully 1 line will come in. I think it's also important to understand that when you do these strategies and get into collaborators, what is your non-negotiable? And for us, it has been pharmaceutical companies. So we said we'll be in any forum, but there shouldn't be a sponsorship or a speaker from a pharma entity. That's our only, again, very, I think, specific, non-negotiable. A lot of things need to be open when you're trying to do this kind of global advocacy, much more open when you are trying to do national level advocacy. And I think, as again, everyone has been saying, do collaborative work. This work cannot be done alone. And this work requires formal and informal interactions. And for the point that Shekhar was making on credibility, I think it's a credibility of an individual, right? Who are you as a person? What's your connect with the individuals who are holding those spaces? While they are representing organization and you are representing organization, it needs to be connect between those 2 individuals. So relationships need to be built in. And you need to look at these relationships beyond this event. I think if you are very transactional in that relationship building, it may not happen. And for me, while this is a global event and that 1 sentence may or may not happen, okay, I'm very, very hopeful it will happen. It needs to be a relationship that I can leverage in future. So for MHI, this was a great learning experience. It's very different from the advocacy we do because we have done that in the past as teams, as group of people talking together. Within the MHI team also, there would be multiple people. This was mostly led at a very senior level. And of course, also, to be transparent, we are a grant-making organization, so we come with funding, right? So the funders in the room, please fund for advocacy. Advocacy requires, I think, headspace, and that requires senior management and senior resources. and those efforts need to be funded. So I think we had that advantage of doing that. Our learning from the process has been that be opportunistic about it. It's okay if you don't want to be part of it. There have been other global events that we have chosen not to participate. This was the one that we chose to be part of. And I think asks need to be simple. I mean, that's, for a global event, for a first time introduction into a G20 thing, you need the ask to be simple. Oh, I forgot, we also interacted with the G20 directly. So what we did was we had interaction with Women at Work, which is a G20 event, and we combined that with disability, women with disability. So we had a Women at Work, Women with Disability at Work event, and we again talked about disability-related issues and included psychosocial disabilities within that conversation. So you also need to interact not just with C20, but the G20 also in many ways. So yeah, it's been a great journey so far. Thank you.
Thank you both so much. So what I'm going to ask the audience to do now is... Battery change didn't help, clearly, but that's okay. What I'm going to ask the audience to do now is that I know we are limited on time, but I want to give everyone an opportunity now to think what we're going to do with the learnings from this, because I think I can speak for everyone. We're all feeling pretty inspired about what the global advocacy landscape looks like and what our roles are within that at a national and at a global level. I want everyone to have a think and turn to a person near you, behind you, and just have a quick 1-minute discussion about what are some key global events or even national events that are coming up that are a good place for you or your organisation to advocate for mental health at. And then I'm going to ask the panel for some of their recommendations. And then I'm going to allow the floor to have some final questions. So turn to somebody near you, have a discussion, and I'll call you all back.
Stand down.
An event, like a global thing. Thank you for engaging with that one. I hope that you learn about some different global or national events that are coming up. I know that a lot of you are still talking, and I'm so sorry to interrupt. So I hope that you continue these conversations at networking afterwards. or throughout the rest of the conference. What we're going to do now is I'm actually going to hand over to Aditya to share about an event that is coming up. And then I'm going to pass the mic back to the crowd to ask any final burning questions. So Aditya, would you mind sharing with us the event you were just speaking about?
Okay.
Oh, you don't have a mic, sorry.
Actually, in the Asia Pacific and ASEAN, in Asia Pacific, there is a forum called United Nations Economic and Social Commission in Asia Pacific, or UNESCAP, which mainly talk about the human rights and social economic things. And last time it held in Jakarta, but we can find out where it will be held next time. And it is a great thing for us to, to conduct advocacy, especially on the human rights issue, because the mental health have close relations with human rights issue. Last time in Jakarta, our project partner in Indonesia conduct advocacy on how the stigma reducing, as well as the deinstitutionalizations of persons with psychosocial disabilities who lived in the mental health institution, because they do not get a proper treatment in the mental health institution. So that's why we, our partner in Indonesia, conduct advocacy on that thing. Besides of that, because we live in Southeast Asia, and now Indonesia become the lead of the ASEAN Forum, and we also plan to do advocacy on the social inclusion, and that's why we could integrate mental health on that as well. And it is still in progressing, and hopefully, finger crossed, we could find the good thing later on. Thank you.
So now we'll go to the crowd. We've got a chance to have one or maybe two questions. So anybody had a question? I know people at the back had a question. Yes, great.
Thank you very much, distinguished panelists, for all your insightful presentations, contributions. I just want to ask, seeing all of the engagements happening at the global community, and then now we're also marrying it at what should be happening at the national level. Bearing in mind that no matter what happens at the global space, even though we have representations from the national, attending either from the government or from the CSOs, but then for anything to effectually happen at the national, the government plays a very important role. I want to ask, is there anything that some of the global agencies or organizations present here, is there anything that can be done to provide support to the national CSOs or national organizations that can help them carry out more, engaging advocacies to their government to ensure that what they hear or what they agree to at the global space, when they come back at the national level, we want to see full implementation. I give an example. Now, right now, after several decades, Nigeria just have got the National Mental Health Act. But as we speak, there is still yet no implementation. Though it happened December 30th, and it was made public to Nigerians on the 6th January this year. But we haven't seen yet a clear roadmap or commitment, even from the global community, to help see that such a significant effort that has come to bear should be supported to at least a bearable minimum in terms of implementation. What can the global community actors do to help the national actors in terms of seeing some realistic engagement from the government? Thank you.
Great question. Thank you so much. So we have a minute and a half to answer this one. which I know is a big ask. So who would like to take that question? And this is open as well to our speakers or our panelists.
Just very quickly on that point, I think that, to unlock, okay, so many of those agencies that you're referring to or talking to haven't had or have only recently had budget lines for mental health. And so there's a lot of work to try and develop mental health strategies that can be inserted into those agencies' wider strategies. And a lot of that will come from that work at the global level about making sure that mental health is spoken about in all policies, in all possible places, so that we move from a situation where mental health is noticeable by its inclusion in global documents, policies, declarations, to it being noticeable by its absence in those. And if we get to that situation where we've changed the ecosystem around the international community, where it is a prerequisite that mental health is included in how we do education and how we do sanitation, how we do justice, how we do health writ large, then there's much more chance that those agencies, those technical agencies with the funding, will have space within their budgets for mental health, which is allocated to mental health. So that's not an immediate fix for what you're talking about, but it is about changing the ecosystem at the global level so that mental health is a part of how we do our work.
Great, thank you, James. And so speedy. Wasn't that efficient? And Mark, what did you want to add to that? I think. Was it not working?
No, I do actually. First of all, your question is so important, and I'd love to talk to you afterwards. I think this question is a very general question. You ask me, what if a country doesn't go further with its commitments, and what can the global agencies do? I think for each situation, each country, we should specifically discuss. Because for each country, it will be different, and then we use formal and informal ways to talk to people like myself, people at UNICEF and different agencies. Also informally, and then see what are, again, just like any advocacy, what is the strategic points? Formally, an agency like WHO is there to serve the government in the country. That's how we are invited to the country. So that's how it works. So, but it doesn't mean we do nothing unless the government asks us to do something. So there's a conversation to be had, but there's not one simple standard answer. So happy to talk afterwards.
Well, Mark and James are the right people to answer that question from the global side, but I have a suggestion. These kind of meetings are very useful for putting country people with other country people. So your situation is exactly similar to what India had a few years back. So I would suggest that you learn from other countries too, as to how after the act was enacted, how did the implementation start, what were the barriers, and how they could solve it. So that kind of approach can also be quite useful.
Great, thank you so much. I know we could continue talking about this topic for so much longer, so I do urge you to use networking, to use our breaks to continue to have these discussions, because it's a complex problem and there's so much to continue discussing. But I really want to thank our panelists and our presenters. I think it was really wonderful to start with you, Aditya, and hearing your success within the C20 and the G20, and hearing what you're doing, Priti, with MHI currently, and the steps, breaking it down really simply about your key messages and what's important to advocate for and how to go about that. So I really want to thank you, and I want to thank our panel for your wonderful insights and answering these questions. There's so much that we could summarize, but I think the most important thing that I've heard from this panel and across all of today really has been the importance of connection and connecting with others across country, within your own communities, and leveraging those connections, leveraging the work that we're doing at a global level to improve our national advocacy, but also using our national advocacy to then bridge that gap with our global advocacy. And something that you said, Shekhar, I'd like to add to is around our global advocacy has no meaning if we're not translating it to the national level, because it's not impacting people. But I'd also like to add on that our national advocacy doesn't have as much impact if we're not translating that additionally to the global level. So I think that's really my ask for all of you today, to use your words, Priti. The one ask is that we continue to think about how we can have these impact conversations on a national and a global level, and what that looks like for each of our contexts. But please join me in thanking all of our wonderful panelists and speakers.
Nice presentation.
So what will be done is that we're going to create a little bit of a global roadmap, some of the things that we've discussed and some of the key events, and Ali will be in touch about that. She's just at the back waving. But thank you all and enjoy the rest of today.
Thank you.
Thanks, everyone.
Thank you, yes.
Thanks.
Just a bit of housekeeping. This was the last session of the day. The shuttles will arrive in about 30 minutes, but you have time until then to just network, talk to each other. And I think there's also some food still outside, so help yourselves.